Assalamu alaikum wa rahmatullahi wa barakatuhu. Hypothesis testing, case crossover studies, study of triggers within an individual, case and control component, but information of both components will come from the same individual. Case component hazards period, which is the time period right before the disease or event onset. Control component control period, which is a specialized period interval other than the hazard period. Epidemiological studies designs, squad studies, and observational designs comparing individual with the no risk factors or exposures with others without the risk factor or exposures. Looking for a difference in the risk of a disease over time. Best observational studies. Data usually collected prospectively, some retrospectively. Study populations free of disease, factor present, factor absent, disease, no disease, disease, no disease. Time frame of studies. Prospective studies looks forward, looks to the futures, examine futures events, follows a conditions, concerns or disease into the future. Prospective study measures exposures and confounder variables, exposed outcomes, non-exposed outcome. Time frame of studies retrospective to look back in time to study events that have already occurred. Retrospective quad study measures exposures and confounder variable, exposed outcome, non-exposed outcome. Quad studies strength exposure status determined before disease detections, subject selected before disease detections, can study several outcomes for each exposures, limitations, expensive and time consuming, inefficient for rare diseases or diseases with long latency, lost to follow up. Experimental studies investigator can control the exposures akin to laboratory experiments except living populations are the subjects. Generally involves random assignment to groups. Clinical trial are the most well-known experimental designs. The ultimate step in testing causal hypothesis. Experimental studies. In an experiment, we are interested in the consequences of some treatment on some outcome. The subjects in the study who actually receive the treatment of interest are called the treatment group. The subject in the study who receive no treatment or a different treatment are called the comparison group. Epidemiological study designs randomized controlled trials. A design with subject randomly assigned to treatment and comparison groups provides most convincing evidence of relationship between exposures and effect. Not possible to use RCT to test effect of exposure that are expected to be harmful for ethical reasons. Randomizations study populations, interventions and control, outcome not outcome, control, outcome not outcome. Epidemiological study designs, randomized control trials. The gold standard of research designs provides most convincing evidence of relationship between exposures and effect. The trials of hormone replacement therapy in menopausal women found to no protections for heart disease, contradicting finding of prior observational studies. Randomized control trials. Disadvantage very expensive, non appropriate to answer certain types of questions. It may be unethical, for example, to assign person to certain treatment or comparison groups. Review questions developed by the super course team. Describe the link between exposures and disease. Describe study design sequence. Describe strength and weakness of each design. Thank you very much. Allah Hafiz.